another autoimmune condition to talk about. And this time, I'm not going to give you a diagnosis. I'm going to show you how to guide your way through a station without knowing what's the diagnosis. I don't even know what the diagnosis. So a patient came. The patients complain of pain in the in the shoulders and in the hips. Okay? Yes, we all think of polymyalgia rheumatica, but it could be osteomyelitis. It could be hypothyroidism. It could be a million other things. Okay? It could be dermatitis. Now, this is how I need you to approach. First, you go through the history one by one, the same questions we talked about. You want to ask here. You don't have to ask about like the risk factors because we don't know what we're aiming, right? Want to exclude. So you want to try to find other reasons and exclude them. Here, the differential diagnosis is important. Basically, you want in the differential diagnosis that you have, you want to find anything that would guide you. So let's say it is polymyalgia rheumatica, but you don't know you didn't get it. What do they need you to know? They need you to know that if it was polymyalgia rheumatica, when are you going to send the patient for the hospital? Straight away. Do you know? Giant cell arthritis. It comes very common with polymyalgia rheumatica. So that's why you need to ask about vision, change in vision, things like this. If the patient said yes, pack your bags and to the hospital. Very easy. You don't have to, okay, the patient said there's no blurred vision. You still, I don't know what this is. I don't know what this is. That's okay. Don't stress. Once you get into the management, you can simply say, I want to do some investigations. So you need the CK, you need the thyroid function because you want to rule out thyroid issues. You need LDH. You want to concentrate on the physiotherapy as well. You want to give, painkillers, I'm sorry. Here, it is important to mention that you want to escalate to your seniors because you don't know the diagnosis. I don't know the diagnosis. Okay, hypothetically speaking, you decided to start the patient on steroid. You really have your mindset, okay, I know what this is. This is polymyalgia rheumatica. Okay, you're playing with fire. As long as there's no clear cut thing, don't ever say, I know what you have is polymyalgia. Say, well, it could be polymyalgia rheumatica. I'm going to discuss this with my seniors because without the full blood, without the full investigation result, you can't diagnose polymyalgia rheumatica. I'm going to discuss this with my seniors. They might start you on a medication called steroid. If you improve, that would actually work in the benefit of our diagnosis. You see, you didn't treat, but you showed that you know something. You don't want to be reckless, but you want to be smart.